we're starting with the first extract of today. I'd like to start with Roche, and we're more than happy to welcome Dr. Christoph Franz, Chairman of the Board of Roche, with us for the opening remarks of today's event. So, Dr. Christoph Franz, thank you very much for giving us the honor and for joining us today, and welcome to our expo, and stage is yours.
Joining us and for again sharing today what you've done in the batch and what you're doing here. So now we're starting with the first extract of today. I'd like to start with Roche, and we're more than happy to welcome.
Now it seems to work. So hello everybody. It's a big pleasure to be back here again at batch number 4 of Startup Creasphere. We are still super excited about this collaboration with Plug and Play and the opportunity to get to know so many young entrepreneurs with great ideas. And that is extremely close to our hearts at Roche, because our company is depending in our future on our ability to innovate. And this means, first of all, you run big research and development departments, and you run also development departments developing IT and digital things, but all this is probably not enough to be successful in the future. The future depends on the fact to partner with all these 99% of the greatest ideas which are generated outside our company. So for us, getting in touch with people who have these great ideas is not only something which is nice, but it is something which is absolutely essential in our business to be on the forefront of innovation, and thus create a sustainable and a successful future for a company like Roche, which is committed to improving health of all people around the world. What we are great in is obviously science. That's something where we have been successful for many decades. Now there is an additional challenge, because we learn that it's not only developing highly sophisticated tests like our famous COVID tests, which we have created in a few weeks' time only to contribute to manage this pandemic, but it's also in pharmaceuticals, where we more and more have the need to create insight using digital tools. And this is something where the whole company has to not only learn, but also shift our attitude, creating what is a kind of startup spirit, working in an agile way. This is something which is not normal for big companies like ours, but it is something what we in many cases can learn from small startups. And that's the reason why it is so important for us to expose not only ourselves with great ideas from outside, but expose ourselves also with entrepreneurs who have a different mindset, who have this agile way of creating pilots and prototypes. And this is exactly where we can learn a lot. At the same time, we have to learn something else. We have to learn how to collaborate with these startups. And that is something what provides us Startup Creasphere, because we are able for some of our people in the digital world to interact with digital startups, and thus giving us an idea how to organize ourselves and what attitude it needs inside a company like Roche. And at the same time, it is also changing a mindset from not invented here to steal with pride. So basically bringing great ideas into the company. And that's what I enjoy personally. And to underline it, I'm happy as the chairman of such a big company to be here every time I can, because I feel this is the future for the company. Thanks a lot and good luck now for the pitches.
Thank you very much, Mr. Franz, for your kind words and for these encouraging, energetic words. Thank you very much. And now, Dr. Jochen Hurlebaus, I'd like to hand over the word to you. You were also the initiator from the Roche side for Startup Creasphere, and you're also introducing the startup pitches for Roche today. So Jochen, stage is yours.
Yeah, thank you very much. And I want to first thank Christoph Franz for his contribution and that he's here today as the chairman of Roche. It's a great honor, and that actually he came back the second time is even a bigger honor because it shows it's of real value for him, and he sees the benefit, as he has just expressed, in for us working with digital companies, learning from digital companies, looking what ideas they have and how they can help Roche in the future. He also mentioned the open innovation aspects that we have very big as a big topic within Startup Creasphere. And we are also on that end very happy that Startup Creasphere is growing, the ecosystem is getting bigger. You also mentioned, Friederike, that we will have Microsoft now as a new partner, so we are also very happy on that end. And beyond that, we also going more global, right? So Munich is still our center of Startup Creasphere. We have been engaging before already quite significantly on the APEC side, and we are also very happy that our colleagues from Diagnostic Information Solutions and Molecular Solutions are now an active partner in the Silicon Valley Plug-and-Play Health Accelerator and have been embarking with their first startups there. In Singapore, we actually also will kick off batch 0, so a first local batch with a few startups that will be focusing on more commercial topics, topics which are specific for the APEC region, which obviously is also becoming more and more important. It's a very different culture in many aspects, so it's also very important for us as a global company that we engage with the local ecosystems and we see what is happening there on the ground. So yeah, we are very happy with that. This batch obviously was a bit specific. It was a purely virtual batch. We have never seen any of the startups in person, but it worked tremendously well. We are super happy. We also heard, of course, which is even more important, that actually our pilot owners, but also the startups are very happy about the results and what has happened. And I also want to particularly thank here Plug-and-Play for doing a tremendously good job in organizing these virtual sessions, which actually are more difficult to organize. Everything has to fit 100%. The technology has to fit to make it really successful. And that has been working really, really well. That said, we are obviously looking forward to hopefully have in the next kickoff in October, at least a partly on-site batch, if possible, or kickoff. We will see how that goes, how the situation develops. But yeah, now today, I'm looking really forward to see the batch, the pitches of the 5 startups that we had in our batch. And yeah, wish you all an insightful next couple of hours. Thank you very much. Have a good time.
Thank you very much, Jochen, for your kind words. And thank you very much. Last time we were in this room together for the kickoff. Now I hopefully to see you soon again. And now I'd like to hand over the word to my colleague Fabian from the venture side, who will be guiding you through the startup pitches and moderate the Q&A. And please be so kind as to be as interactive and engaging as possible with your questions. Thank you.
Thank you very much, Friederike. Hello to everyone also from my side. To quickly introduce myself, my name is Fabian. I'm working on the venture side for the Startup Creasphere program, working closely together with our champions, but also with the pilot teams of our partners to guide the process prior to the program to select the right startup according to their business needs. So for the upcoming pitches we will see on the Roche part, we have 5 companies based out of 3 continents. We have something in the cardiovascular space, but also in the big data, going all the way to the knowledge-based space. But first of all, I'd like to, guide you through the housekeeping quickly again. For the next slide, as Friederike already mentioned, we're going to use Slido for our Q&A session. Slido is also embedded in our plug-and-play events app. So you can scan either a QR code to directly go to those to the application through your phone, or in case you're at your computer, you can also type in slide.do, and the code is #SCB4. From a general structure side for the pitches, we will see a short introduction video from the pilot owner or the pilot team, and also the startups, talking quickly about their experience and about their collaboration. Then we will see a 5 minutes pitch by the startup, which is directly followed then by a 2 minutes Q&A session. For the startups, quick reminder, please introduce yourself prior to the pitch and then start sharing your screen. So that being said, I'd like to kick it off with Eko.ai. Fun fact about Eko.ai, the founder, James, actually already founded several other companies and decided never to found again. But then, as it happens, he decided one day to found Eko.ai, and that's where we stand now. So enjoy the pitch.
Eko.ai uses machine learning to automate the fight against heart disease. We've developed a fully automated AI platform for the analysis of echocardiograms, which are a doctor's tool of choice to visualize the heart.
We already spotted Eko.ai due to their exceptional combination of deep knowledge and expertise on one side, as well as commercial excellence on the other side. In this project, partners are spread between Singapore, Netherlands, UK and Switzerland, and the virtual setup was anyhow the most efficient way to proceed with this collaboration. So we defined the clear objectives, timelines, we did a very detailed project planning and set up proactively the calls where we will discuss all questions and align on the next steps.
Good evening, everyone from Singapore. My name is James Hare. I'm CEO of Eko.ai, and I will now share screen. So Eko.ai is automating the fight against cardiovascular disease with machine learning. This is a huge fight. Unfortunately, the reality is that 1 in 3 of us on this call today will die of cardiovascular disease. It's the world's #1 killer. And not too long ago, unfortunately, I thought I was going to be the unlucky one. This is a ECG. As you see, it says abnormal at the top. And I received it while, frankly, living the good life. My last company had gone IPO. I'd retired. I was kite surfing around the world. And I just, by chance, happened to get this, which got me very worried. And the first thing you need to do if you're worried about your heart is visualize it. And the doctor's tool of choice to visualize the heart is echo, or ultrasound of the heart. Now, despite being married to a cardiologist, it still took me a month to get my heart visualized. And then I ended up getting 2 different readings from 2 different doctors. Fortunately, the reading that said I'm okay was the right one, but it introduced me to this world of echocardiography. Even though it's the safest, most common imaging tool, it's still slow. It takes a half an hour to image the heart, and then another half an hour to do all of the manual annotations you need to do the measurements. It's error prone, as I saw in my own case. There's huge variability amongst readings, and it's relatively expensive. So the reality is, despite being retired, I started thinking, oh my gosh, there's a way to improve this process, and I could no longer sleep. And since I like to say it's the dumbest thing in the world to be retired and not be able to sleep, Eko.ai was born. We built a software solution that basically takes this 30-minute process of 250 clicks and 21% variability and turn it into something that's 2 clicks, 2 minutes, 1 click, and 0 variability. Here's a very short demo of the software you can see. Our tool is basically a search engine because all of the work, all the hard effort happens behind the scenes. For doctors, they simply look for their patient, they click, and they go to a report. The report is already annotated. The main findings are there. You can very quickly see the shape of the heart, the main conclusions that we found. You can hover over all of the measurements that we've done, so there's no need to do anything. Hover over them. We do 2D videos and Doppler modalities as well. At any time, you can click and see how these measurements compare to the reference guidelines. And if you have any doubts, you can click through to the measurement page, scroll through all of the images, pick different measurements because we do orders of magnitude more measurements than can be done by hand, edit anything that you want, and it's all done automatically. So we built this software on top of a federated learning platform. Basically, we connected data across sites in multiple countries, and this allowed us to do rapid training and validation across multiple cohorts. Our software comes in two flavors. One is a diagnostics tool for the diagnostics market, but the other, we realized that we could turn these tools into new opportunities and address new, even larger markets in the research and predictive analytics market. All of this was sort of built upon a wonderful collaboration that we had here in Singapore with Singaporean research institutes, and it was built upon a research platform that one of our co-founders built across 11 countries. And we've had fantastic financial support. Our latest round was done with Sequoia and EDBI, which has been a wonderful help and spurred our growth. This is the team that we were able to put together. We've had, frankly, had the good luck to get a who's who of the top imaging core lab leaders from around the world, and that has greatly accelerated our development. And of course, this is the glory slide. We've had a good run, being able to win a bunch of prizes, as well as being rated amongst the top 10% of global startups in our category. So that's a very brief introduction to Eko.ai. Thank you very much for the opportunity to present it to you today.
Thank you very much, James, for all those insights and the good presentation. So we already have the first question incoming. Are you planning to go abroad, and where?
So the funny thing is that we are based in Singapore, and we love being here. It's a fantastic place for growing companies quickly, and there's fantastic government support. But the reality is that all of our markets, our core markets, are elsewhere. So we're already selling our commercial tools to both academic research hospitals and pharmaceutical partners in Europe and the US. All of the commercial deals that we've closed so far are in those two regions. Our regulatory approval strategy for the clinical product will be to start with the US. We're in the process of doing our FDA validation with the Brigham and Women's Hospital in Boston. So we're using Singapore as our launchpad, but frankly, our markets are global.
Thank you. Then the next one would be, how long will it take you to get on the market as a medical device?
So we're like I said, we're in the process now of the regulatory approval process now for the FDA. We're hoping, we'll see how that goes, but we're hoping by Q1 of next year, we will have that approval. Once we have that, our strategy is to immediately pivot to the CE mark in Europe, and then of course the HSA mark here in Singapore.
Fantastic, good luck with that. One more, I think we have time for one more question. Does Eko.ai acquire the Eko data or analyze data that has been captured already? Our process is to analyze data that's captured already for research stuff, but we put our tools into the hands of others. Frankly, the idea is our model is a SaaS-based model where you use our tools in subscription, so you can use our software with all of your already stored images, or acquiring new ones. We're working really closely now with using handheld devices, so you can plug there's a new generation of handheld devices that plug into iPhones or Samsung tablets. Our software works with these. You can acquire your images that way, and then process them, do all of the analysis with our software. Okay, fantastic. Looks, sounds really good. So thank you so much, James, for your time. We will have networking later today. So in case any one of you wants to approach James and learn more about Eko.ai, please go to the Remo ecosystem and application and directly talk to him. Thank you, James.
Thank you.
So maybe as a quick reminder, we have 5 minutes per slot. In case someone goes over time, I will just quickly gong from our side and then wrap it up quickly. But for that being said, the next startup is Jana Care. Jana Care is actually already spread between Barcelona and Washington, and therefore they are quite convenient with the current situation and can easily adapt. So Javier, please kick it off with the video and afterwards with your presentation.
What makes your solution so special? The Jana Care solution for NT-proBNP testing removes any need for a professional to be involved in NT-proBNP testing. This means that the testing can occur in the patient's home.
I think this was already relevant for the heart failure strategy team within Roche, that something needs to improve at the outpatient level, and I think this will even get more predominant now with the COVID-19 outbreak, where most of the countries realize that outpatient care and even home care is really the future and can benefit to a lot of patients.
Jana Care joined Creasphere because it's a great opportunity to be involved with similar companies like our own and to see if there's a potential for collaboration with Roche.
All right, hi everyone. My name is Javier Chenique. I'm the Director of Product at Jana Care, and I'm happy to present to you this afternoon. Let me share my screen now. All right, everyone, and what I'd like to talk about today is our fingerstick NT-proBNP test. A little background on heart failure. It's a chronic and progressive disease, and it's caused by the heart's inability to pump enough blood to meet the needs of the body. And it's, as you can see on the chart on the right, when you look at the red line, it's punctuated by acute decompensation events where the patient gets significantly worse, has to go to the hospital, and they only trend downward from then on. So this disease affects 26 million people around the world, and very importantly, 30% of all hospital readmissions around the world are due to heart failure. The good thing is that appropriate care and monitoring can help avoid these decompensation episodes and improve the patient outcomes. So unfortunately, the current monitoring options don't satisfy the customer's need. Right now, the most common monitoring option is weight monitoring by patients taking their weight every day and journaling this. Unfortunately, the predictive power of weight monitoring is very, very poor. On the very other side are implanted devices such as the CardioMEMS device, which is a pulmonary artery pressure monitoring device. This offers incredible information that is very predictive about pressures inside the heart. Unfortunately, this is an implantable device, so there's a risk to implant. Plus, it's a very expensive device, and around the world, the reimbursement is not very good. So unfortunately, this has hindered the adoption of this device in a more broad way around the world. So the last option is NT-proBNP monitoring. NT-proBNP is a heart failure biomarker that's very powerful and has a very predictive, it's very predictive as has been established by clinical trials over the last 20 years. The downside to NT-proBNP up to today is that it can only be performed in a professional setting. So a professional has to take the blood sample and a professional would have to do the blood testing. Jana Care aims to improve the situation by enabling NT-proBNP assisted heart failure management through the world's first fingerstick compatible NT-proBNP test. So this is done with two pieces of technology. First, INA is our smartphone-based lateral flow diagnostics platform. And then Habits is our digital coaching platform. It's software that runs on a smartphone that both runs the INA analyzer and it also coaches the patient on heart failure on a daily basis. Notable firsts for this product include the system is designed purely for heart failure prognosis. It's to monitor heart failure patients. The system, like a glucose test, is fingerstick compatible. It uses a very small amount of blood compared to current NT-proBNP tests that allow a patient to take their own blood sample at home and perform the test. No professionals need to be involved in here. Also, there's no sample preparation. The patient would literally put the blood sample onto our cartridge and run the test. All this information is sent up to the cloud via our app, where physicians can interact with the data on a remote dashboard. Plus, this information can be auto-synced to electronic health records that the hospital has. Finally, the system is very easy for patients to live with. It's self-calibrating and it's room temperature stable. So to give an example of how a patient and a physician might work with the system, so the patient may interact on a regular basis with the checklist on our app, and the checklist periodically reminds the patient to test their NT-proBNP. When the patient tests their NT-proBNP, the result is sent up to the cloud, and if the result is significant, both the doctor and the patient may be notified to take action. At that point, it's up to the doctor and the patient what to do, but for example, they may ask the patient to visit the clinic or to adjust the therapies, or the patient may receive additional education to help them in their situation. So as part of the Creasphere program, we actually validated that there was a huge unmet need for heart failure monitoring via NT-proBNP. We did a survey of 154 cardiologists and general practitioners in Europe to understand their use practices, and we uncovered important information. First, we understood that on average, heart failure patients are tested for their NT-proBNP only twice a year. But when we asked these respondents, how often would you want to test NT-proBNP if you were unrestricted? The answer was much higher. If a patient was recently discharged, they would want to test more on a weekly basis. And if the patient is more stable and has spent some time out of the hospital, the testing would move to more a monthly or quarterly basis. But this is significantly more than what their current testing regimen is. The respondents also responded that the vast majority of them would test recently discharged patients, but up to 1/3 of the respondents said they would just test they would continue monitoring all their heart failure patients. And of the 154 respondents, 85% of them said that they would be willing to adopt the Jana Care NT-proBNP monitoring solution. So what's left for us to do with Roche and Jana Care? We have a great opportunity to improve the life of heart failure patients. We've validated our product market fit. We understand the market access and regulatory implications. So the next things to work on with Roche are to explore a strategic fit with them, to understand how we fit in Roche's portfolio. Next, Jana Care will give Roche a hands-on experience with the product itself. And finally, Jana Care will work with Roche to formulate ideas of how to structure an ongoing collaboration. Thank you very much.
Thank you very much, Javier. So we've already had the first questions. One of them is for the results you're testing. In which EHR platforms can you already implement those data and transfer it to?
So you'd have to work with my IT team. I don't know how the specifics of this. Our home base is in Boston, but also in Bangalore in India. We've integrated into hospitals in Bangalore and Singapore. I don't know the specifics about what those EHRs are called.
Okay, fantastic. Thank you. Where AINA systems can be used, so can you use them at home, or do you need to go to a specific location?
Yeah, so the test system we're in the middle of developing right now would be for use in both point of care situations, for example, in a doctor's office, in a pharmacy, in one of those settings where like maybe a nurse can run it. But additionally, importantly, it's being made for home usage where a patient can test themselves like a glucose test.
Okay, fantastic. Thank you. And then for the patients that test using your device, what's the initial feedback? How do they accept it? Do they like it? Would they prefer to go to a doctor?
So the system is not yet out in the market for testing. So Jana Care is already commercial with diabetes tests, and we have experience with patients testing themselves at home. And as long as the testing burden isn't overwhelming, not too much testing, the patients are fine with this. And especially now when patients don't really want to go to the hospitals for fear of COVID, there's a very big openness to doing these things from home as much as possible.
Okay, I assume so. Thank you very much, Javier, for answering all the questions. And again, here also you can meet him later in our networking tool and ask any questions that might be open. Then, thank you, Javier.
Thank you.
So up next, I'm really happy to introduce our portfolio company, Sorcero. We had incredible experiences with them. They've already been part of multiple batches across multiple locations. So kicking it off and handing it over to Richard, and first of all, the video.
Sorcero's natural language processing suite is helping us to automate the maintenance of medical guidelines. With Sorcero's technology, we can rapidly identify changes in new versions of medical guidelines, and we can adapt smart testing algorithms accordingly.
Sorcero applied its language intelligence platform to be able to apply layered understanding so that we could look at everything from oncology to neuropsychiatry, to apply that to those medical guidelines and be able to go into those medical decision trees and say things that were added and reduced, symptoms, treatments, and diagnostics, and match that together.
I believe that working with young and innovative digital technical companies is key for the success of Roche in the future.
So please, Richard, go ahead.
Thank you very much, Fabian, for that lovely introduction. My name is Richard Graves. I'm the Chief Commercial Officer and co-founder at Sorcero. I previously have had a career in launching and scaling companies in fintech and renewable energy with data science and big data enabled companies. So it's a real pleasure to be able to work with the team here. So I wanted to introduce, for all the folks who haven't worked with Sorcero before, our platform and technology. It was a lovely introduction. And what we're doing here at Sorcero is delivering scientific and medical language intelligence, helping power millions of critical decisions. What we've built is a platform that can enable life sciences companies to understand, access, and leverage medical and scientific expertise at scale. One of the biggest challenges with actually applying the technology that we work in, artificial intelligence, to the very complex, highly technical workflows that life sciences companies are dependent on, is that general domain AI may understand language, but it doesn't understand your work. It doesn't understand the medical domain. It doesn't understand the words, the concepts of the language that is actually required to understand the applications of diagnostics, treatments, and the work of clinicians. What we've built is a platform with three unique capabilities. One is we've built the first low-code platform for language intelligence, taking tools from both the natural language family of technologies and artificial intelligence, machine learning, deep learning, et cetera, technologies, so that you can actually build intelligent applications with them in days, not months. We built a cognitive tower that can auto-assemble enterprise and domain-specific ontologies, things like oncology or understanding neuropsychiatry, to significantly boost the AI performance for the mission-critical workflows against those needs. So we really can provide deep, detailed understanding of the workflows that you are doing, the language that you depend on, and even the concepts that a doctor or a point-of-care provider may really need. Lastly, it's a turnkey platform. The data science teams that are building AI solutions within enterprise typically spend 80% of their time cleaning data and trying to harvest learnings and redeploy them against applications. And our platform as a service automatically does that, enabling them to focus on pushing innovation forward, while a production level platform can deliver applications to solve those problems with clear ROI models. Our platform, this is a little overview of it. This is a lot, but what it shows is we have the technology to take an ingestion of many of the most important sources and formats, apply that through a cognitive tower that can parse it and translate it into an AI native knowledge fabric that can then, we can apply our AI and language intelligence services to generate some tremendous capabilities and deploy it with the platform. Our cognitive tower actually has these 4 layers of understanding, which unlocks very specialized documents in ways people haven't seen before, taking from NLP, natural language processing, natural language understanding, domain understanding, and then enterprise understanding and enterprise expertise models themselves. Our leadership team that's built this, it's been a real pleasure to work with them. Dipanta Das, our founder and CEO, actually scaled public health technology platforms in 20 countries, working with the Red Cross, Bloomberg, Gates Foundation, and others before the company. And Walter Bender, our CTO, co-founded and led the MIT Media Lab, one of the world's preeminent technology innovation centers in the world, developed the idea of personalized content, and now is working with us on personalized AI. And Amy Gallagher, who scaled Priceline through the RPO, and has worked with public EHR and health solutions in the United States. So with our goal, with our pilot here with Roche, was actually to take medical intelligence and apply that to raw literature. So we could actually understand and transform real-time updates from scientific and medical literature, including guidelines, and turn it into a parsable, deployable, software-defined solution. So this shows just a little bit of how we actually transform these documents, which most systems can't really understand, and actually turn into fully parsed, understood systems that are deployable. And so we process and understand complex medical literature so that we can pull out medical tests from documents, symptoms, demographics, disease states, disease progressions, 10 times faster, more reliably, all in real time. And what that actually means is we can identify changes and differences so that if a medical guideline, of which there are 11,000 sources that may filter into the diseases that people are tracking, you might need to know that in that 40-page new medical guideline in that peer-reviewed journal or from that association, these are the 3 sections that really impact someone who is prescribing a diagnostic, trying to divine the disease state or get those results. And we're able to show all that in real time, identifying changes, not just words, but actual tests that are added or subtracted, symptoms and more. And then augment medical delivery. So that's kind of what we did with our pilot, and we're really excited for the capabilities that we're providing the Roche team. So thank you.
Thank you very much, Richard, for that introduction. The first question has already came up, and it's around the batch programs. So how did your experience with the Startup Creasphere batch differentiate to the experiences with the other batches?
Absolutely. So one of the things I have to say is the Roche team and the Startup Creasphere team was fantastic, but in a very particular way. I think people often think that innovation just requires creativity, but it actually requires discipline. It requires the ability to start right away, have clearly defined problems, have the data available, and the workflows to actually work through that. And both the Creasphere and the Roche team did a fantastic job with getting us what we needed, so we were able to start at day one. And frankly, the technology solution that we delivered, when we started that, they said it might take 3 to 5 years for this to get developed. Because it was so well structured and we were able to apply our technology, we were in, I think, 6 weeks, we had a first proof of concept that actually showed that we could do something that, that previously they didn't believe was technically possible.
That's fantastic. So we already had the next one. Medical guidelines are based on text. Do you think they can be algorithmically automated?
That's what we proved here, actually. So we are able to take in unstructured text and pull in the full meaning of what is added, subtracted, and changed from not just a text level, but a conceptual level. What exactly is a disease state and progression? What exactly is a test that's added or subtracted? And that's what we proved here, and we're really looking forward to scaling this with Roche.
Fantastic. And then also adding up to this, what are the next steps? Or the next month?
So the next steps is we're going to be working with Roche to actually scale this up, to actually look at 1,000 medical guidelines to the next year. We're also finding that this technology can really apply to regulatory compliance. It can apply to other needs, so IVDR needs. This can work fantastically to monitor the scientific and medical literature for those compliance and applications, as well as research competitors in the market, other applications, and find the literature real time that demonstrates that this diagnostic, this pharmaceutical treatment actually has evidence that can be used for payers and to healthcare providers.
Fantastic.
Thank you, Fabian.
Thank you very much, Richard. Here again, you can meet him later in the REMA application and talk to him directly if you want to. Get to know Sorcero better. Thanks, Richard.
Thank you.
So up next, we have our only German-based company. It's Statice. They are all focusing on synthetic data, and how they do it, you will see up next.
At Statice, we see ourselves as the safeguard of individuals' privacy and a technological enabler for our customers, which are companies, to unlock potential of sensitive or prior sensitive data. We do this by offering a data anonymization software that enables companies to easily use sensitive data, and this is done by the creation of so-called synthetic data.
I'm currently working with Statice on a collaboration investigating the power of synthetic data. This area has been rapidly growing in recent years, and we're keen to see how we can utilize this power in a clinical data setting. We have identified a number of areas that we're interested in, including software testing, medical data insights, and data sharing. Working within startup is a very new experience for me, as all of my background is with big pharma. This is a very different way of working, and it's been a really exciting privilege to be involved.
Okay, Sebastian, over to you.
Thanks for the kind intro. And I can only mirror what Alex said. It was a pleasure for us to be involved as well. So happy to share a little bit more about Statice, as well as what we've been up to with Roche throughout this project. As mentioned, and as you saw, we are working on synthetic data for the purpose of data anonymization. Why we're doing this is because we believe the ability to use data is elementary for ongoing digitization efforts, but of course also the ability for companies such as Roche to collaborate on sensitive data or data that's priorly really not accessible. The way we do this and what exactly we're trying to solve is the ability for companies to work on something resembling real data, which we consider synthetic data. The idea here is that our software is able to create a copy of an original set of data, preserving none of the sensitive information, but still preserving the overall statistical and structural aspects of such data. And this allows us to believe in a future where data itself is absolutely transparent and open to be used without absolutely no privacy implications for companies, and of course, therefore also for customers and users. The software itself builds on something that's considered as the so-called privacy-preserving deep generative models. So in itself, the software uses machine learning models that learn and train on a given original source of data, understanding statistical information and relationships, and using this knowledge to, as mentioned before, generate a new set of data that, again, statistically, structurally mimics the original data as much as possible, but really does not allow for any link to the original data, and therefore for any re-identification of information that can be linked to a real person, and therefore making sure that data utility, but also data privacy, are very much preserved to a maximum extent. With Roche, we applied this technology and applied our software to understanding how clinical trial data can be potentially protected and secured, and still preserving the statistical relevance and accuracy, as Alex pointed out in the video, for subsequent analyses, software testing, and the ability to make data accessible across the Roche organization. And the way we did this is we started working with a publicly available data set stemming from the Harvard Dataverse, which provided a lot of different challenges because the data itself only provided insights on roughly 120 patients, which for whoever knows a little bit about data protection and anonymization, can't quite bring a few challenges when it comes to making sure data does not really provide insights or information back to individuals that can be found in such data. The challenge for us and the goal of this project was to generate data that, in terms of utility, mimics the insights, but still make sure that there's no information too close to the real data. And we're quite happy to see that the results of this joint project and as part of the Creasphere program actually proved that to work. Now, what looks quite complex is really just a snapshot of evaluations in a showcase that we were actually able, together with Roche, to create data strongly mimicking statistical trends and statistical information present in the real data into the synthetic data. And this is a quick snapshot of a few evaluations that we generated throughout this project, and serving the idea to gain an impression on how this new data looks like and how it also behaves very similarly. So what we did basically here is visualizing the information and distributions of the original data in blue, and on the newly created synthetic data in orange, and mapping them over each other. What we also showed And again, this is just for visualization purposes. Don't be scared off by the graph. But what we also can see here is that a lot of different information, such as correlations across both data sets, have been preserved very nicely, allowing for a lot of statistical tests to be run and performed on synthetic data where prior data is not available. And in the end, what we actually resolved in and realized that at the conclusion of the project is that it's very possible for us to generate statistically similar and privacy preserving data stemming from these clinical trial data, and giving us a lot of interesting hope and of course also perspectives on the applicability of this synthetic data for Roche in the future. Which brings us to the question, what's next? And we're currently in talks with Roche to extend our engagement on, of course, internal sources of data at Roche, in making sure that we can also apply the technology and software on internal sources and really generate more additional value from sensitive insight or sensitive internal data in terms of opening data internally, and of course also the ability to share data for machine learning application development, prototypical purposes, or generating new insights with partners. Thank you very much.
Thank you very much, Sebastian, for this great presentation. So now we have the first question. It's rather more on the general side. So you've been working also with other institutions, with other industries. How did the big pharma collaboration or the work differentiate with regards to those other industries?
That's a great question. I think the big difference, or there's definitely a few points that might be a little different. I think the biggest difference stems with the challenges preserved in the data itself. If you look at other industries that we've been active in, which mostly concern the financial or insurance space, we tend to see masses of data that are all very much available within one big, big environment. And here we're really talking about small subsets of data that itself obviously preserve a quite big challenge, as mentioned before, when preserving statistical accuracy, but still protecting individuals when there might only be 100 or so people in the data itself. On the other side, the experience has been very fantastic in terms of collaboration. We had a very great exchange, got a lot of very insightful and collaborative feedback from the partners at Roche, which was very fantastic. So in that case, we can only, can only confirm that this was a great experience from our side too.
We're really happy to hear that. Maybe one more question also on the data, on the data perspective. What do you think is the advantage of synthetic data compared to anonymous data?
Well, I think what's important here is that we synthesize data for the purpose of anonymization. So the goal is to create something that's mimicking original data as close as possible, while being absolutely anonymous. So I wouldn't necessarily, split the concepts here, but really see synthesization of data as a way to anonymize data. There are more traditional approaches to anonymization of data, which, for example, concern the obfuscation or changing of certain information within original source of original data set, which unfortunately have a lot of drawbacks when it, for example, comes to security and preservation of privacy. There's a lot of research already available showing how certain methodologies might still result in the potential re-identification of people, so-called linkage attacks being performed. On the other side, some methodologies tend to generalize data quite extensively, and therefore resulting in a huge loss of granularity and information. Something, again, where we try to really bridge those two worlds to make sure data is preserved or data is available in a very granular way, but still privacy preserving and anonymous.
That's great. One last question. Is there a chance to lose data when you synthesize?
Well, the original data always remains where it is, and we never actually, the software never deletes or changes any of the original data. So the only thing we do is really generate a new set of data, which means that whatever we had available as a company originally still is there and just remains untouched in any way. If the question aims at statistical loss in data, that can happen, but that's really a matter of what data is originally available. If we see sets of data such as what presented here, we had a minimal loss in a few areas. The more data that is available, which is also, of course, sometimes something more typical, then there's a very, very rare and small loss possible, but usually negligible.
Okay, Fantastic. Thank you so much for the clarification, Sebastian. Looking forward to chat to you later, and also for everyone else, Grima is the place to go.
Thanks a lot.
Okay, then up next, last but not least, is Grakn. They developed something called Grakn, and what that is all about, you will see up next.
Great, good. Oh, Grakn is an open source knowledge-based software that enables developers to build technologies that solve some of the world's most complex problems out there. We've been working very diligently with the team at Roche to build a POC that shows how you can use Grakn to find new drug targets. Now, I have to thank the team at Roche tremendously for their help throughout this process.
I feel this has really been a co-creation between two parties, and that none of us would have been able to achieve these goals without the other's expertise and input. Due to the nature of the project, which was all based on data and software, going virtual was not a big problem at all. In fact, the virtual format is the one that makes most sense for this type of project.
So great, good. Pleasure to share with you what we've been working on with Norman and David and the team at Roche. Also, a big thank you to Fabian and Christina and everyone at Plug and Play for making this happen. So I know I'm the last one, so I won't take too much of your time, but I am quite excited to share what we've been working on. So I'll first start with just a couple of high-level introduction of what Grakn is, and then I'll quickly do a live demo as well to just bring what we've done to life as well. So what is Grakn? Now, Grakn, first and foremost, Grakn is a database software. So we build software that developers use to build applications, typically the applications that work with very complex data. And to illustrate the problem when you're working with complex data, it's useful to look at logistical domain. So when we're modeling a logistical domain, we usually start with a product that needs to get to a destination. But as the real world is made up of, we have different constraints in doing that. We have to model the employees, their availabilities, the fact that they have to sleep, the fact that different delivery methods, and all sorts of different constraints and things that we want to model in our domain. And that needs to happen in the database usually. So when we do that and we want to use some sort of traditional methods, it's very often that the model becomes too complex. And we end up with SQL queries that can look like this, which is quite difficult which may take an engineer half a day to write, for example. Now, with Grakn, what we've built is effectively a knowledge representation system and a language, Grakn being the database and Grakn being the language, that allows users to effectively work with data work with complex data in a much easier way. And so to demonstrate the particular point, the query on the left, which is actually looking for drugs connected to diseases or specifically asthma, which is 150 lines of code, we can reduce to just four or five lines of code in our language. And the difference isn't necessarily about counting the lines of code, but it's got a useful indicator, especially when I don't have much time to share the details on how the implementation works under the hood. Now, I also like to share kind of the main tenets of the language, because simplicity in the language is really important. So if anyone watching this is a developer, on the right you see the language that defines your schema. And so we've spent our lives to making sure the language is as simple to use and as easy to onboard as possible. So these little keywords like sub and has, we've spent so much time to making them just 3 keywords, and if we can make them even smaller while making it still maintainable and readable, we would do that. Now, in the project that we've worked on with the team at Roche, we've looked at specifically at how can we find and identify new targets. So we first looked within the disease space of IBD, so inflammatory bowel disease. Now these 3 targets, and this is a screenshot from Open Targets, identifies CIBV and IL-10 and JAK3 as some of the top targets that everyone knows of. So these are, again, this is a screenshot from the Open Targets platform. But what we wanted to find out is effectively how can we actually find more targets. And this is a screenshot from our visualization tool, where we see that after we've put the data into Grakn, we can identify the different links between IBD and these commonly known targets. But what we wanted to find out, and this is at this point I'll share a different screen with you as well. We wanted to find what we call what Norman and David at Roche called latent indicators. So what are some not so easily identifiable targets? And these targets we called order 2 targets. So what you're looking at right now, and I hope you can see this, this is work-based. This is our visualization tool that allows a developer or a bioinformatician to effectively navigate your knowledge graph as you build your application on top of Grakn. So we have a query here, and I've got Grakn running on my computer, and I already ran the query before I started to speak. What we see, and I've had to mask the actual names of the targets, by the way, because it is confidential. I've just called them gene C, gene B, and gene A. So we get this connection, and we query specifically for order 2 type of relations. But the interesting thing about this here is that we can actually get an explanation why. Why did Grakn create these relations? Because we have certain hypotheses that we put under the hood. So I can press explain here, and I get this explanation why Grakn created that relation. So we see that under the hood, gene A apparently is being encoded by this protein that has an interaction with this other protein, which is encoded by this other gene called JAK3, which has what we called a order 1 relation with IBD. And similarly, we have this gene B, which has a genetic location that is very near to this IL-10, and that distant we effectively model and allow us, and there's this order 1 relation between IBD and IL-10. And similarly, this gene C, we find that there's a gene family, so-called gene family, or a Hawk family, as the data was called, between CIBB and gene C. And then we know, and then because of they're familiar, we effectively can possibly find that other gene C to be also a target that we may be interested in. So that's a very kind of fast whirlwind of what the demo is, of what we built in this particular pilot. But the key is about representing the knowledge that's in our minds so that we can effectively query over that. So to go back to the slides, now we can also, what we also did for the purposes of working with the data, and these are just the slides from what I just showed, is we can also output this, of course, in an Excel file. So those familiar with Excel, we can actually also find that here we see these are the A, B, and C, which are masked, which are of order 2 relation, which go via these potential targets. But the interesting thing is that for those targets that we identified, or they were known, and the pilot is not productizable yet, is that when you go back to open targets, you can actually see where they sit. And actually 2 of the targets that we found are actually very lowly ranked. I can't show the actual rank, but they're somewhere around rank 700 and rank 1000. And in fact, one of the genes is not even in the list. And so as a final point, we're extremely proud of our open source community. And I always want to say that because our core software is actually open source. And if you do want to learn about Grakn, head out there. Our team is there. I'm there. Send me a message. Download Grakn today if you want. Play around with. We've got also an open source biological knowledge graph called BioGrakn. And I also like to share that we're very proud. We had our first conference in January, actually February, just before the lockdown happened. We had a couple of hundred people come from all over the world, attend our conference, all of our users, and we had a blast. It was just before lockdown happened. The timing couldn't have been better. And thank you. And please do follow us. Our GitHub link is there. And join us on Discord. And do follow us on Twitter or your favorite social media platform. So I hope I did well on time. Fabian, over to you.
Thank you very much, Thomas, for that great presentation and also the demo. Maybe adding up quickly onto your open source approach. How did the open source approach impact the collaboration with Roche?
Well, it just makes it so much easier because what we did with the pilot with Roche allowed us to leverage other open source ontologies that others have developed. And so we leveraged that to kickstart the project. And by that ontology, I mean, how do we represent different types of relations under the hood? What's the schema that we wanted to define? And most of that came from BioGrakn, which is this open source biological knowledge graph that anyone can use. And in fact, a lot of pharmaceuticals are using that today to which they extend and they make it private, of course. And so the open source really allows the dissemination of knowledge to spread much faster, because a lot of these data sets are public. And so for a lot of the more private companies, the goal is to how do we integrate this with our own private data. Now, for the purpose of this demo, the great thing about being in the open source is that we didn't have to go through any legal wrangling, because we just stick to publicly available data.
Fantastic. Maybe also adding up to that, there's a twofold question. First of all, how do your knowledge graphs differentiate to companies such as Benevolent AI or Innoplexis? And then based upon that, can you also ingest unpublished research data?
So I want to be very clear to whoever asked that question and anyone else who may think that. So a company like Benevolent AI and a company like Innoplexis, those would be users of our technology. In fact, I can't say too much, but there are teams that are looking and are using our technology within those companies. So Grakn is a database software that is used to build other software. So companies like Benevolent AI exist and are running with Grakn. One I can mention, Eko.ai, for example, they've got their entire platform running on Grakn. So they build their products on top of Grakn. So Grakn doesn't have to differentiate itself, because it's a completely different thing. Grakn is a developer tool that developers use to build software, and so in that sense, it is quite low level. And I appreciate if perhaps many in this call aren't familiar with what that means, but I hope for those technically versed, I hope that makes sense. Yeah.
And then maybe the second part of the question was, can you ingest unpublished research data? More on the privacy.
So Grakn, so we never publish any data as such, in the sense that we just build a product that other people use. So the question should be rather anyone out there. So all the 276 participants of this call can today go to Grakn.ai, download Grakn in the open source, put their data into Grakn, and decide whether they want to publish that open source or not. That's up to whoever uses that. So it's not up to us. You use the technology as you wish to do, as you would with any other database software, whether it's PostgreSQL or MongoDB.
Okay, fantastic. Thank you so much, Tomasz. Grakn has webinars on a regular basis, so you can just directly go to the website and subscribe to that if you want to learn more. Otherwise, there would also be our remote tool later, as mentioned.
We have one tomorrow evening as well. Tomorrow evening.
Fantastic. Then handing it over again to Friederike, who's now guide you through the executive portion.
Thank you very much. Thank you to the startups, and thank you for the Q&A part, Fabian. And now welcome Dr. Franz Sieben. Nice to meet you virtually. Frank, he leads the in vitro diagnostic business for centralized laboratories at Roche Diagnostics. Thank you very much for joining us and for accepting the agenda point to ask the executive. So if you would like to quickly introduce yourself, thank you for joining. I'm just waiting for the tool to get all the questions in. So everyone, please feel free to ask questions over Slido or our event app. And digital solutions are playing an important role more and more, also with more diagnostic information collected, like digital biomarkers, which is also very, very important for you, Frank. So if you would like to quickly give us an introduction of yourself, and thank you for joining us while the questions are coming in.
Yeah, thanks, Friederike, for the nice words. Thanks also for all participants. Basically, it's really inspiring also from my end, from our end, to be part of that, and it's really great to see the passion and contribution. So thanks a lot. A few words on my side. I have the last years been working in the healthcare environment in pharma and diagnostics on the commercial side, so running commercial organizations, but also on the global side, and had also the opportunity to being exposed to different fields, more in the disease areas like cardiovascular oncology, but also on new digital fields, for instance, in new digital health solutions, which we are placing jointly as new commercial models to our customers.
Thank you very much, Frank, for the introduction. And now, as the first questions are coming in, and please also feel free to network at a later point. The first question would be, how did you like the startup pitches, and how are they actually relevant for what you do as the franchise lead at Roche Diagnostics?
Thanks, Frederica. I'm a little biased, I have to admit, because in our franchise, we are focusing on disease areas like, for instance, cardiovascular, and therefore, obviously, specifically the two ones, specifically, working on these fields of improving patient care on CHF and cardiovascular diseases. Obviously, it's very close to our business heart, but also to my heart, right?
Yes, that's true. Thank you. And another question that came up is, how is digitalization important for the lab, and how are you planning to digitize the core lab?
Yeah, I think that's a pretty pivotal question also from our end. I think we have seen, the presentations very much coming from a patient end. And I see we are seeing much more that also our traditional customers, the lab customers, actually are also being much more exposed to the questions on how is their market, how are their customers basically developing and changing. And therefore, I think it's of great importance that also we, as a traditional lab supplier, are basically tapping into new fields, into new business models to help our customers basically addressing their increasing demands of their customers, being at the hospitals, be it the patients, but be it also the physicians, actually.
Okay, thank you very much. So we do not have so much time left, unfortunately, for this part. One last question in regards to the digitalization of the lab. What fascinates you most when working with startups, and also in relation to the core lab of the future?
So I think I start with the later part. I think we are currently in an important time window of opportunity to really change the business dynamics. We see very changing market dynamics as recently in the COVID situation being accelerated. And I think it's a very interesting time to be in that field, being in that storm and sensing how our customer landscape is being changing. And I think it's of crucial importance to be very fast, to act fast, but to also understand, how do we can create new business models, ideally together with our customers. And here I see the crucial importance to work with startups, as we've seen today, basically to set up us for success in a joint collaboration with our customers for the future.
Thank you very much. We have a little bit less than a minute left. One question, you mentioned the speed and you have to be fast. One question on that one was, how fast can these digital solutions be implemented?
That's a tricky one. I think theoretically it could be very fast if you just sense about, applying an algorithm or, in software on a cloud-based solutions. However, we also need to acknowledge that, the world is not yet there in all cases. Specifically, the healthcare industry is sometimes a little bit lagging behind other industries. So I think there's also kind of an educational bit, right, to help basically our industry to accelerate and to adopt these kind of solutions much faster.
Thank you very much. This is a nice closing remark also for this. Thank you very much for answering the questions and for taking the time.